www.disabilitiestudy.com. Now, let me introduce you all to our resource speaker for today. Dr. Mary Grace Gomez is a professor and a registered guidance counselor and also a registered professional teacher. She's a professor at the Counselor Education Area, College of Education, University of Philippines. She teaches counseling and research courses at undergraduate and graduate levels. She holds several qualifications, including a doctorate in special education, has rich experience as a class teacher, guidance counselor, administrator in basic and tertiary educational settings. She also is an expert in assessing and managing children with disabilities and delinquents in conflict with the laws. It's a pleasure to have you here with us today, ma'am. Before I hand over the podium to you, I'd like to share with all the participants that the current session would be for 2 hours. The first hour would be a presentation by the resource speaker, followed by the Q&A segment. Also, based on your inputs, after the resource speaker starts with our presentation, we would be switching the chat to the host and panelists, and the chat would be only resumed post the speakers sharing during the Q&A session. Happy learning to you all, and let's learn from our expert speaker to broaden our understanding about disabilities today. Over to you, ma'am.
Okay, good evening to everyone and welcome to today's webinar. We are having a lot of learning today, and we will be discussing a topic that is very close to my heart. It's about disabilities, and it's about identifying the red flags of disability. And I know that there are a lot of teachers attending this webinar today. You would be asking, how can I say that I have a student with disabilities in my classroom? What are the red flags? How would I be able to help them? So we will be discussing, identifying, we'll be having some foundational knowledge about disabilities and disability management. In this session, I will be walking through the different kinds of disabilities, and I will be identifying how assessment is done for some disabilities, but you will also have a session on assessment. And then I would also talk about some practical management techniques. But before we start anything, let's have a Mentimeter activity. I have posted the link on Mentimeter. We will be doing a check-in activity. A check-in activity is very important nowadays because most of us are into remote learning. So I would like to enjoin everyone to follow the link and click on the Mentimeter activity. It's a very simple activity. The title is, what is your emoji today? Are you happy, sad, angry, or calm? I have posted the link already. Okay, so there are participants already who are logging in their responses. Thank you very much. There's one participant that says he or she is happy. Take note that there are no emails collected, so every data presented would be in confidence, held in confidence. So let's wait for some participants to log in their answers. At present, there are 733 participants. I enjoin everyone to participate because I am reflecting what is being done in the actual classroom, especially if you are engaged in remote or online learning. Check-in sessions are very important in the new normal because it would enable each student to have a voice.
Ma'am, just to add on, in addition to the response over Mentimeter, we also have our participants replying actively on the chat box. A lot of them are happy and calm.
Happy and calm. Oh yes, a lot of them are happy and calm. Okay, happy. It's okay also to feel sad and angry. These feelings are valid. So we had the polls. Majority of the participants are happy. Some are calm, and there are also participants who are sad and who are angry. All of these feelings are normal, and we do experience a whole gamut of feelings. So if ever there is a need for help for people who are sad, and if ever you're a teacher and you find that some people are sad in class, you would be able to reach out and you would be able to know why these students are feeling sad. So let's have the discussion now. Okay, now my screen is not working. Excuse me, I just have to restart because my screen just froze. Okay, here. It's not working. Why is it not working? I think I have to reload it. Everything is not working yet. So we have some technical glitches that happens. Okay, so we talk about foundational knowledge about disabilities and disability management. Before we start, let's have a recap of the child development and skills building webinar that you had. We talked about the framework of child development, there's neurological development, the domains of development, cognitive, physical, social, emotional, speech, and communication. Aside from that, you also have the psychomotor domain. You have the gross motor and fine motor domain. It is very much important to identify how the children develop across various domains in order for you to know if there are gaps or in order for you to know if they are advanced in specific domains. And then you talked about developmental delays. You talked about the causes and reasons for the delays and the red flags. There are also core skills building. You nurture relationships in order for you to accommodate and in order for you to help a specific child with disability. There are brain and core skills development that you have discussed in the previous webinar, and there are different activities for core skills development. All of these were discussed in the previous webinars. Now let's have an overview of what we will be learning today. We discussed first of all this of the disorder. What is this? When do you say that someone has a disorder? Usually you talk about the 4Ds, and this is in the literature. We talk about the types of disabilities in the regular class. We have neurodevelopmental disabilities, physical, sensorial, internalizing, and externalizing behavior, which is very much prevalent nowadays, especially when they go to high school. And then we understand the difference between an impairment, disability, and handicap. So we end up with some tips. How do we manage them? What are the tips that we have for educators? What are the tips that we have for parents? And we give some real life case studies. Let's start. When do you say that the person has a disorder? So we discuss disorder in the sense that something is not working well. That's why it's called a disorder. And there are 4Ds. We have deviance, dysfunction, distress, and danger. We will be talking about this one by one. So if you say deviance, usually you would have statistical deviance. And if you were studying your measurement and evaluation courses in pre-service training, when you were taking your degrees in teacher education, you would have met the bell curve. And you would see here that there is statistical deviance if you are either at the extreme right or the extreme left. Let's take, for example, that this bell curve represents the IQ of different students. Of course, you will have here at the farthest right the students who are brilliant when it comes to IQ. Perhaps their IQs would be 140, 150, 160, 180, depending on the type of test that they took. And then at the extreme left, you have students here who would have intellectual disability. So you are talking here about IQs of 60, 40, and below. So when you talk about deviance, first you have statistical deviance. How often does this behavior occur? It could be that there would be some people who would be very intelligent and some people who would be needing a lot of support when it comes to academics. It could also mean that a lot of people could perform regular tasks of, let's say, for example, skipping, running, jumping. A lot of children would be able to do that. But there would be some children who would be needing some assistance. And there would be some children who are excellent in performing that task. We also talk about social deviance. So most people in the community find the behavior to be totally odd or different. Let's say, for example, in a community, if it is accepted that you hear voices coming from ancestors who have already died, that is not considered as a social deviance if that is a community practice. But if you will go to a community that says, oh no, we don't hear voices coming from dead ancestors, this is not considered as a social deviance. So social deviance is defined as most people in the community find the behavior to be odd or totally different. So if you see this picture of a woman who has tattoos all over her body, would you consider this as deviance or would you consider this as art? In some communities, it would be considered as a deviance. No, we don't allow that. But in some communities, they would say, okay, that is a perfect method of expressing himself or herself. So when it comes to deviance, you have to understand that there are some communities that accept and some communities that do not accept it. Then dysfunction. If you say that there is dysfunction, this is a point in which a person has significant impairment in life. And this significant impairment affects relationships at home, at work, interpersonal, school relationships, everything gets affected. I have here some example. Because of severe anxiety, Dan cannot go to work anymore. Because of severe anxiety, Van opts to stay at home and lie down because he shakes at the moment he goes out of his or her of his house. The deficits in social skills made Sue withdraw from school clubs. And yes, sometimes deficits in social skills would make a student underperform. Or sometimes the student won't attend class anymore. Now, when it comes to deficits in social skills, you also have to consider is a child being victimized by bullying. So, there is a disability if there is a dysfunction. And then you talk about distress. It causes anxiety, ill feelings, or negative feelings. It can be felt by the person himself or herself. It can be felt by other people in contact with him or her. During this time of the pandemic, I'd like you to pause for a while and think, were there some issues and experiences in your life wherein severe distress haunted you? Just think and pause for a while. Yes, and were you able to recover? Most likely you were. However, for children who have internalizing behavior, the distress can be so much that it could cripple them, that it could cut relationships, that it would make them underperform in school. Let's have some examples. Kumar is feeling so down that he refuses to go out with his friends. He doesn't watch his favorite TV programs anymore. Or he even refuses to take a bath. Have you felt like this? Have you had a student who felt like this? Let's go to another example. People are avoiding Ola because she always fights with them and makes unnecessary demands. As a teacher, have you encountered students, parents, or teachers that fight with you and make unnecessary demands? Distress can be felt by the person himself or the people in the immediate environment. This is how some disabilities could affect you. Behaviors are detrimental to the people who are suffering from this distress and the people around them. Let's take this for example. Yasmin, 14 years old, has casual and unprotected sex with acquaintances whenever she is at a manic break. Sometimes there would be teachers who would say, oh no, this person is just having his or her day and there are a lot of casual sex happening. Or they are just like this. Sometimes there are reasons behind the behavior. Sometimes it could be a manic break. Let's have another example. When Armin gets angry, he throws things and hurts other people. So you have here a problem with impulse control. Whenever Callie fails a quiz, she cuts her wrist with a big blade. There's distress to self. And of course, if you are a dorm manager or if you are a teacher and the student does this inside of the classroom, you would definitely feel distress, especially if there are some, if the student has fainted or the student has big wounds that you have to rush the student to the hospital. So this is distress. These are other indicators. Subjective distress. So we talked about distress already. Maladaptiveness. You cannot perform. Let's say, for example, third graders are expected to add two-digit numbers already. But a specific student cannot do so. So there's maladaptiveness. Statistical deviance, we talked about. Social discomfort, we talked about that in distress. Irrationality and unpredictability, and they could be very impulsive. And last is dangerousness, causing harm to self and causing harm to others. Let's first talk about commonly used terms. We have here impairment, disability, and handicap. So when is there an impairment? There is an impairment if something is structurally wrong. So let's take this for an example. Tisha was born without eyes. Klein has a shorter limb. All of these are impairments because something is physically wrong, structurally wrong. It becomes a disability when they cannot do something. That's for, say, for example, for Tisha, if she was born without any eyes, definitely she won't be able to see. There's no mechanism at all for the child to see. If a person was born with a shorter limb, definitely there would be difficulties in walking. So it becomes a disability. Now, when does it become a handicap? It becomes a handicap if you present a barrier. Take note that Tisha only cannot see, but Tisha can read. She can read in Braille. Tisha, if she has the talent, can sing. She can cook. She can live independently through orientation and mobility. And there is much hope, even to people who have lost their sight. You say handicap if you present a barrier. Let's say, for example, Tisha's teacher tells her, you cannot pass this English test unless you name all the colors that are on the blackboard. Tisha won't be able to do that because Tisha doesn't have any eyes. Let's say, for example, you let your students who are totally deaf answer a dictation test. Of course, they won't be able to do so because they are totally deaf unless they know how to read. Hopefully, we present a non-handicapping environment to our children with disabilities. Disabilities can be congenital. You can be born with them. A chromosomal anomaly can make you have a disability. It could be acquired or adventitious. An accident could happen, and this could cause you the disability. So disabilities can either be congenital or adventitious or acquired. Before anything else, I would like to stress on the importance of assessment. Assessment helps in intervention, and there are various purposes of assessment. You can do assessment for diagnostic purposes. So you will be needing a lot of standardized tests. You also have assessment inside the school. Teachers make a lot of assessment, and these are non-standardized ways. There would be a session on non-standardized assessment. You need assessment in order for you to create relevant programs. For example, I'm a guidance counselor, and before I create programs for specific populations, I always make sure that I know the needs, because my program has to be responsive to the needs of the people. Otherwise, you can have a very beautiful program, but the beautiful program can be irrelevant. You need to know what the needs are. When, the, when done by a qualified professional, and when I say qualified professional, you have a relevant degree and you have a professional license. Usually, professional licenses are given by the government. There is no such thing as a proper assessment unless protocols have been violated. And let's realize that diagnosis can vary. It is dependent on many variables, and it is dependent on what the person who is assessing saw during the assessment. It could also progress. Sometimes you would see one disability and then you would see other facets of the disability, or you could observe other disabilities present. So next time when you have assessment, bear in mind that there is no such thing as improper assessment. Assessment has a lot of purposes. Assessment is done by various specialists. You have here standardized tests, and these are usually done for diagnostic purposes. You have A level, B level, and C level. So A level tests, teachers can usually administer this, or if you have relevant training, these are usually in the form of achievement tests. So you want to identify the specific grade level, and these are administered in. Take note that when you administer a group test, it does not mean that there is a group score. Yes, you can compute for group meaning, but the interpretation is always at the individual level. You can only administer the test to a group. That's why they are called group tests. It doesn't necessarily mean that the group score will be interpreted. And then you have level B tests. You need a relevant bachelor's degree plus special training, or a relevant master's degree plus training. Sometimes they will look for your license for level B. They're quite strict for level B. So these are usually personality tests. And you can only purchase these tests if you have relevant degrees. And level 3 or level C test, you need a relevant master's or doctoral degree plus training. Take note that these standardized tests can only be purchased if you have your credentials. You need to have your credentials, the degrees that are necessary, and the licenses that are necessary that are given by the government. Next, when you make purchases, the publisher will ask for your credentials and will evaluate your credentials as to whether you will be given these tests. It takes a lot of practice for level C tests because these are the tests that usually are used for diagnosis. Let's look at some tests. So these are examples of C-level tests. You have IQ test. So you need here professional qualification. It's a master's degree in psychology plus relevant training, or a PhD in counseling. So you have here test of Sanford Binet and the Wechsler Intelligence Scale for children, because we are talking about the preschool level. These tests would identify levels of intellectual functioning. So if you want to test for giftedness, or if you want to test for intellectual disability, you get the C-level tests. And these tests can only be purchased by a qualified professional. Second, these tests are quite expensive. The last time I canvassed, it was worth around $1,500. That's why assessment is quite expensive, because the norms here come from different countries, and you have to shell out a lot of money in order for you to print, to procure materials, to get a lot of respondents, etc. And then a lot of people are saying that I am depressed. I have this, I have that. I think that I am depressed. I have anxiety. I have bipolar disorder. You cannot say so unless you have taken these tests. We have the Minnesota Multiphasic Inventory for adolescents, the Minnesota Multiphasic Inventory, this is for adults, the Milon Adolescent Clinical Inventory, and the Milon Clinical Multi-Action Inventory. These are clinical tests that identify psychopathology. So these are C-level clinical tests. These are given. And then your psychiatrist can be using the DSM-5 or the Diagnostic and Statistical Manual for Mental Disorders. It also has parallel diagnosis with the ICD-10, International Statistical Classification of Diseases and Related Health Problems, and the International Classification of Functioning. So if you are talking about a clinical setting, most probably you will see the DSM-5. Aside from the tests, take note that there should be a clinical interview with parents, with caregivers, and with teachers. Sometimes developmental checklists will be accomplished. There are observation checklists, and there are other skills that are to be given. If the person doing assessment is a clinical psychologist, projective tests can be given. You have to administer this battery of tests in order for you to make clinical diagnosis. I'm laying this foundation so that everyone would know that it is not easy to identify a disability. You have to go through the process and there should be training. These are types of disabilities in the classroom: neurodevelopmental, physical, sensorial, internalizing, and externalizing behavior. So from our audience today, I'd just like to know what types of disabilities are there in your classroom. You can put your responses in the chat box. We have here dyslexia and ADHD, developmental delays, hearing, cerebral palsy, multiple, ASD, autism, ADHD, ID, GD. Yes, from Rika, ADHD, from Shima, ADHD, from Camila, speech delayed students. So we can see from the audience that there are various types of disabilities. Thank you very much to our participants who have filled in their answers. You can see here that there are various disabilities in the regular classroom. Just have to restart the slides because my screen froze. That happens in the new normal. And we are in a live setting. That is very normal to happen, that you have technical glitches. But as I tell my students always and my counselees, if life throws you lemons, you make lemonade. You make the best out of it and you continue.
Ma'am, you could move on to view and click on full screen mode.
Sorry, yeah. Thank you very much, ma'am.
That's
okay. Now let's begin the discussion on neurodevelopmental disorders. So you have here global developmental delay, intellectual disability, autism, ADHD, and specific learning disability. I will be describing these conditions to you, but I won't be specifying the diagnostic criteria named by the DSM-5. Why is this so? If you have identified all the characteristics, there is a tendency for people to label. And we don't label. We go to professionals for diagnosis. It's very much difficult if people will go around pathologizing children. Oh, you have autism, you have ADHD, etc. So what do? You, of course, look for red flags, and I'll be discussing some red flags. So if you say global developmental delay, there would be a delay in the cognitive domain, the psychomotor domain, the language communication domain, and sometimes even self-help. Take note that GDD is only a temporary diagnosis and is only done and is only given up to age 5. And then you go to intellectual disability. After age 5, you screen for intellectual disability. You can only screen for intellectual disability if you have a standardized test. You need the Wetzler or the Stanford Binet because these are clinically accepted tests. And then you need autism. You have autism. And autism is a spectrum. You have some children with autism who can use language. You have children with autism, sometimes displaying hand flapping, some have self-injurious behavior. So you have a lot of behaviors associated with autism. Usually they would have problems in expressive and receptive language. That's why you have the phenomenon of having echolalia. You would be discussing autism in depth in the future MPT workshops. And then you have ADHD. So you, of course, have children who have this inside the classroom. You would have children who are inattentive, and you would have children who are impulsive and hyperactive. These are the two main types of ADHD. We will be discussing ADHD in a future MPT workshop. And then you have specific learning disability. In DSM-4, you have dyscalculia, dysgraphia, and dyslexia, and dysgraphia. So you have these three disabilities. Now you say that you have SLD because they have identified through research and through fMRI studies that if you have learning disability, there are unique functioning in the brain that are not that cause you not to understand, for example, what you have read, that would make you see that the letters are spinning. So this would be SLD. And then you have physical disabilities. You have muscular disabilities and you have skeletal disabilities. These are obvious disabilities. And unless you have a comorbidity, let's say, for example, you have a child has intellectual disability. So if the child has a physical disability and an intellectual disability, chances are that child would be placed in a special education classroom. But if it's only physical disabilities, that child has to be placed in the regular class, and that child should have modifications only in physical education. And then you have sensorial disabilities, the senses. So you have hearing impairment. If you say it's a hearing impairment, it's medicalized, but you would also see in the literature deaf. If you see deaf with a capital D, this refers to the signing population, and they are referring themselves to a unique ethnic minority group that has a specific language. And this is sign language. Some people who are deaf would opt not to use sign language. They would opt to lip read and use their voice. And then for blindness, you will have here totally blind and persons with low vision. If the student has total blindness, he or she would have to use braille. If it is low vision, you will just have to use large print or let the student use a magnifying glass. And of course, there's technology to help the student with blindness. You could also use screen readers and talking books. You talk about internalizing disorders. So if you have internalizing disorders, I chose two that are most common. You have anxiety. And if you say anxiety, the key feature here is worry. So if you say worry, anxiety is related to worry. I'm worried about future mistakes. I am worried about what will happen tomorrow. It's very difficult to worry about what will happen tomorrow because it has not yet happened. And then depression. Depression is characterized by sadness. And usually you have an extreme level of sadness when you have depression. Take note that you need to fulfill criteria for depression before you say that you have depression. Depression also comes in many forms. Let's talk about unipolar depression first. The first is MDD, major depressive disorder, single episode, and then there's full recovery. You could see there that there are straight lines. The straight lines represent normal mood. Okay? When the person has depression, initially he or she will have a normal mood. And then the mood would be depressed. The degree of the curve depends on how depressed the person is. So it's just an illustration. So when you have a single episode depression, unipolar, you get depressed once and then you recover. However, there are people who will have major depressive disorders that are recurrent. So sometimes they are okay, and then they will feel depressed, and then they will feel okay again, normal mood, and then they go back to a mood that is not normal anymore. There could be recurrent major depressive disorder, and there is no recovery within the episodes. Sometimes it can take 2 years. And then you also have persistent depressive disorder, which is also known as dysthymia. In this situation, the person is constantly in a mood. And then you have MDD, major depressive disorder that could be recurrent. And it is superimposed on a dysthymic disorder. This is also known as double depression. You can see here that the person suffering from MDD or double depression, you will see here that there is no normal mood. The person is either sad or very sad. So this is how unipolar depression works. And then we will talk about bipolar depression. So you have here two opposing poles. That's why it's called bipolar. So you have bipolar 1 and bipolar 2. Let's take these for example. So in bipolar 1, you would see here that there is a manic episode. That's why it's capital M. So there are there are criteria to fulfill if you have manic or hypomanic features. So let's just say in this example that the mood is very elevated. So the student, for example, would come to class and spend his allowance on everyone. He would treat everyone to lunch. And then sometimes in adults, you would see people having a spending spree. They would max out their credit cards because they just feel like maxing out their credit cards. So that is an example of someone who's having a manic episode. But of course, you also have other criteria in place. So those are some manifestations or symptoms, but you need to fulfill criteria before you say that the person has bipolar disorder. So you have a manic episode, and then you have a depressive episode. And then it goes back to mania and then depression. Whereas bipolar 2 would have a hypomanic episode and then depression. In the literature, it says that students who have bipolar 2 would wait for their hypomanic episode in order for them to perform in class. So sometimes you could see here students with bipolar 2 performing well in class for the first quarter or for the initial months in school. And then all of a sudden, depression would come and he or she would be failing every test. So this is bipolar. It's a cycle. And then, of course, you can have rapid cycling. wherein you could have the episodes of mania or hypomania and depression fluctuating in a very fast pace. That is called rapid cycling. And yes, there are people who would be in an elevated mood, let's say, for example, be very angry and then cry, and then be very depressed, and then all of a sudden be angry again and then be depressed again. So that is called rapid cycling. And then you have externalizing disorders. For example, conduct disorder and oppositional defiant disorder. So if you have conduct disorder, these are people who have blatant violation of school laws or school rules. You would have here students who would be engaged in arson, for example. That is the worst scenario of conduct disorder that I have handled, that they had intentions of burning the whole school, the student. So, and then you have oppositional defiant disorder, that everything that you say, okay, I won't do it. No, no, no. So the student won't be agreeing to the teacher. So we will be talking about internalizing and externalizing disorders in future episodes. So we will be talking here about common red flags or signs for today. So you have here developmental delay, learning challenges, autism, and psychological and mental health challenges. I would like to pose a question to our teachers, and you can answer in the chat box. How do you know that you would be referring a child for assessment of a specific disability? What are the red flags that you have identified? So I would like you to share your insights here. What are the red flags that you look for in specific students in order for you to refer? Okay, so I would like features, behaviors, okay, behavior that affects the daily life in the classroom, speech issues, not performing, eye contact, isolated behavior, from Bernard, repetitive actions, from Lisa, lack of social interactions, from Sataparma, behavior performance. I hope I'm pronouncing your names well. From Megna, behavior. From Nalim, for eye contact. From Esther, continue showing behavioral issues. So thank you very much for your responses. So here are some red flags. You have here developmental delays first. So does not meet the developmental milestones. Yes, there are some people who have identified this. And then they don't talk. There are problems in pronouncing words, difficulties in finding the right word, difficulties in rhyming, learning the alphabets, the colors, the base, and the beat, difficulties following directions, difficulty with controlling crayons, use of scissors, and trouble with ADL, such as buttoning, having the zippers, and then having the snaps in place, and then learning to tie shoes. Let's remember always that these have to be set within the developmental parameters. And then, for example, they are not startling at loud noises, not recognizing your voice, no babbling, there's no crying, there's no word that has been spoken. So this is a clear delay. If you see this in a child at age 2, if speech has not been there yet, that is definitely a red flag. You have to get the child assessed by a developmental pediatrician, or also if speech is an issue, you need a speech pathologist. So you will have to have multidisciplinary assessment sometimes. And then there are learning challenges. There's trouble learning the connection between letters and sounds, unable to blend sounds. So you have here possibility of a specific learning disorder. Confusing basic words when reading. There are consistent errors in spelling. And then there are reading errors. Sometimes it can be a learning disability. Sometimes it also can be caused by inattentiveness or ADHD. So that's why assessment is very necessary. There would be trouble learning basic math concepts, and there's difficulty telling time and remembering sequences. They are very slow in learning new skills. There are also learning challenges here. For example, difficulty with reading comprehension for math, troubles with open-ended questions and word problems. They dislike reading, and sometimes they dislike writing. Kids with ADHD sometimes dislike writing. They avoid reading aloud. Why? They could not read it. Sometimes the letters are spinning. Some would say that the letters are swimming. They spell the same word differently in a single document. There are poor organizational skills. There is trouble following classroom discussions and expressing thoughts aloud. And there is poor handwriting. For autism, there is limited use of gestures such as giving, showing, waving, clapping. There's delayed speech. There are odd sounds or has an unusual tone of voice. There could be difficulty in making eye contact gestures. There is little or no pretend imitating of other people. So sometimes they could not engage also in joint imitation. They stop using words that they used to say. Sometimes they would be very communicative, and then suddenly this would stop. And then sometimes they use other person's hand as a tool. For example, putting parents' hand on a jar for them to open a lid. So they would use that because they have a deficit in communication. And then there's lack of social interaction, does not look at people. They don't have much expressions. That's why it's very important to teach different kinds of emotions for children with autism. They don't respond when called, but this can also be true for someone who is deaf. They don't draw their attention to things or show that they have interest. They don't hug back when a mom or a dad hugs them. And they don't share enjoyment or interest with others. There could be repetitive behaviors, and they could have rituals such as lining up objects. They could have unusual ways of moving their hands. They could hand flap, finger flap, or they could rock their whole body. They could be very focused or attached with unusual kinds of objects, such as spoons, specific doll, a specific pillow, even if the pillow is very dirty already. There's excessive interest in particular objects or actions that interfere with social interaction. There's unusually sensory interest, such as sniffing objects. I even had a student who loved to touch bald heads. And there's over or under reaction to certain sounds, textures, or other sensories. Some red flags for visual impairment, swollen eyelids. So for visual impairment, the disabilities are obvious. There are bumps or styes around the eyelids, drooping eyelids, does not make eye contact, and then they don't watch your hand and they don't follow objects. There's haziness or a whitish appearance inside the pupil because it's usually a sign of cataracts. Then there's frequent wiggling, drifting, or jerky eye movements, and there's sometimes misalignment between the eyes, or sometimes the eyes are crossing. So that would need an operation to be corrected. There are lack of coordinated eye movements. There's drifting of one eye to look at another object, turning or tilting the head when looking at objects, squinting, closing or covering one eye when looking at an object, excessive tearing when not crying, excessive blinking or squinting, excessive rubbing or touching the eyes, and avoidance and or sensitive to bright lights. Some people with visual impairment would prefer to have magenta or a bright color as a background. Some would prefer black and some would prefer white. So if it's low vision, they have different preferences in background when you are presenting materials. Some would tell me that it's easier for them to read a text if the background is magenta or orange, bright. And some would say, no, I just need white and I just need a large text. So it depends on the person. And then they have difficulty understanding what the person is saying for hearing impairment. They speak differently. They don't respond to his name, to their names when called. Sometimes children with hearing impairment would be mistaken to have autism because they don't respond to their names. Okay? It's very much important that hearing also be tested. They respond inappropriately to questions because they misunderstand. Sometimes they turn the volume up or sit close to the TV because they can't hear. And then there are problems academically, especially if they weren't present before. And there could also be issues in reading comprehension and in language. Because sign language, the structure of sign language is very different from the language that we have. You could have speech and language delays or problems articulating. You could watch others and they could imitate because they really could not hear the directions of the teacher. They complain of earaches and noises. They could not understand what is being said over the phone. They say what or huh several times a day. They watch a speaker's face very intently. And many children's hearing loss escapes detection because they are very successful lip readers. Okay? And then you have psychological and mental health challenge. There's loss of interest and pleasure in doing things that were once enjoyable. They don't go out anymore. They don't enjoy the company of their friends anymore. There is a decreased energy and tiredness. They are unable to concentrate or focus. There is a diminished self-esteem. There are thoughts of guilt and unworthiness. There are pessimistic ideas of the future. There are thoughts of self-harm or suicide, difficulty sleeping, loss of appetite, and lower pain. When people have depression, sometimes they feel pain all over their body. In addition to this, it is also stated in the literature that exercise and keeping fit can help you minimize the symptoms of depression. Extent of management. What can we do? So, when your child receives a diagnosis, first and foremost, keep calm. Have the child assessed by a developmental pediatrician, neurologist, speech pathologist, etc. Depending on what is needs, keep calm. There is still hope. So keep calm. So you can have an assessment and you can have a second opinion. That is your right. And then seek advice from the professionals. However, I also would not advise you to go therapist shopping. If you have established that the child, for example, has autism or learning disability, you don't go therapist hopping or therapist shopping. You have to stick with the therapist because different therapists will do different kinds of intervention, and you have to let the intervention work first before you go therapist shopping. People who do therapist hopping, parents who would always have shop for therapists, we call it therapist shopping, chances are there would be lesser development. So some tips for educators. First is to know about disability. Okay? Pay attention to the red flags inside the classroom. And please, for teachers, I have seen this in various countries that sometimes they post the work of a child with dyslexia and they would say that this child is a Martian or this child came from outer space. Let's not shame our students because it's not their fault to do so. Something is wrong and this has to be corrected. We talk to the parents and to the caregivers in order to understand the child better. And we try our best to explain the situation to them. If possible, we could give accommodation. If needed, talk to the professional outside the school and understand the child better. What is it like for to have autism in a child? What accommodations can I do? Guide the parents for assessment if there is. And I'll be talking about acceptance of a disability and how to tell it to parents. We provide classroom and instructional accommodation to support the child. These are some very practical tips for parents. Some are in the literature and some are practical advice that I would give. Number one is to know about the disability. There is much hope. Know the interest, know the skills. Professionals have different types of tests, and we don't expect the professionals identifying a specific test, and it will give you all the answers. And there are various qualifications for professionals. So it is not true that there is an improper assessment. It depends on the professionals doing the assessment, and it depends on the tests that were administered. And if it would be a non-standardized assessment, then the practices are based on non-standardized needs. And that there is nothing wrong with having non-standardized assessments, particularly in creating projects. That also would be discussed to you. It's very much important for you to have a functional assessment. During assessment, a finding can be identified in one professional's report, but not in the other. That is accepted in the professional world. Sometimes the disability occurred at another date. Sometimes the disability did not manifest. Sometimes the child was very uncooperative. So there are a lot of factors that contribute to the assessment or diagnosis. Some tips for parents: there are various professionals assessing the disability. And if your child is under medication, follow the medication guide properly. Do not skip or alter their schedule. This is particularly true for children, for teens who have depression. Some parents would skip meds. Some parents would say, I will have my child take it every other day so that my child will not get immune. No, that is not so. You have to follow the medication guide properly. Make sure to attend therapy sessions. Do not go therapist shopping, and allow the therapist to make their intervention work first before complaining. And yes, sometimes it takes months before the intervention works, depending on the level of severity and the degree to which the child will be cooperating. Now let's discuss some case scenarios. This is case scenario 1. Malaya is 6 years old. He has no eye contact. He shows hand flapping and has repetitive eye movements. He cannot engage in joint imitation activities. He has difficulty communicating. What must be done? Let's hear it from our audience. What must be done to Malaya? If you see this child inside your classroom, 6 years old, hand flapping, what should be done? Okay. Carla said sensory issues should be assessed. Merchi says it's autism. You have to have assessment first. Camila said talk to the parents. Okay. And then Hannah said, oh, it might be autism. Yes, it might be ADHD, said Cherry. Joseph said, speak to his caregiver and let the parents understand the situation. And hopefully there will be assessment. Seth said, assessment first, do not label yet. And then Michelle said, check for ADHD. Yara said, assess first. Kajal said, get assessment. Wong said, go for a test. Chari said, refer to a professional for assessment. Yes, because the child is showing symptoms of autism, but there has to be assessment first. Let's look at another scenario. Our audience are very participative, and I like the fact that the audience is very participative. My screen just froze, so I have to represent. Okay. So we have here case scenario number 2. So what is case scenario number 2? Anushka is 5 years old. She has not been able to speak clearly. She has difficulty in mastering the names of the colors, learning the alphabet, and counting. She cannot follow simple instruction. What must be done? If you were the teacher, what other observations will you be making? Okay, it says here, Ira Krisha says, refer to professional, assess the student's needs from Crystalline. From Joseph, refer to the professional. From Manuel, refer to the parents. From Loretta, try to know the child first. From Manisha, talk to the parents and get assessment. From Paul, observe for a month or 2, yes, and make some adjustment first with teaching strategies and then talk to the parents. Yes, sometimes we have to observe first because Anushka might not be learning because the parents are busy, or the Anushka might be in an impoverished environment. Let's check first. Talk to the parents and refer to a professional. We are in no place to diagnose a child. Thank you, Ira. Break the task. Thank you, Shanti. Understand the child. Thank you, Eunice. Then inform the parents. And then for Enosha, clinical psychologist assessment. From Sandaya, try to know about the child first. If I mispronounce your name, I'm sorry for that. But I would just like to acknowledge your answers. From Somnia, assessment from a developmental pediatrician. From Emery, refer for assessment. From an assessment from a development pediatrician. From Binu, personal assessment and talk to the child. So you have here some bright ideas, and these can all be done if you see this in the class. Let's have case scenario number 3. Inda is 15 years old. When she was growing up, she was active in school. In fact, she achieved well in school. However, when the lessons became more difficult, she started taking tests. And she has been losing interest in school activities. She is locked up in her room playing computer games at all times. She seldom interacts with her friends. She shouts at everyone entering her room. She was observed to have cuts on her wrist. She seldom talks. She does not eat regularly and has lost interest in bathing and brushing her teeth. In her social media account, she said that she wanted to leave this world. What must be done? So in this case, you have here a child who is engaging in number one, self-harm. And number two, there is a post that she wants to leave the world. So this is an indication of suicidality. Let's remember that in events of harm to self and harm to others, suicidality or homicidality, there is a breach of protocol. You should not hold anything confidential when it comes to suicidality, homicidality, harm to self, and harm to other people. You have to immediately inform the parents and nearest of kin. And leaving this world, that is really a red flag. Now let's take it from the audience. According to Myla, assess and inform the parents to help the child together. From Tara, okay, link. From Sharon, ask and get information to parents and suggest assessment. From Dana Street, talking to parents after the students talk. Go for assessment from Jimmy. From Mariam, seek a pediatrician's opinion on adult assessment. Okay? Assess the child and talk to the parents and suggest to go to the doctor. But immediately, thank you very much. I'll talk to the parents according to Carlo, convince the parents to get help. So in case scenario number 3, this is a definite need. There is a definite need to talk to the parents and have the child really watched over, because this is a sign of suicidality. In the event that you see a student or a child who says this, who, for example, doesn't brush his or eat anymore, says that I will leave the world, I will kill myself, immediately ask, do you intend to kill yourself? Yes, the word to be used is to kill yourself. Why? Students or children who have the intention of killing themselves will tell you that they do so. It will not create other triggers in them. You will have to identify if the student is at risk for suicide. You have to inform the parents. Why? I have talked to friends and teachers who knew about suicide attempts of their students. Now, what happened? The student committed suicide, the friend committed suicide, and they kept it mum. They kept it a secret. I always ask, which do you prefer? A student, a friend who loves you for life, but is already dead, or a student who might be hating you, or a friend who might not be your friend anymore, but is still alive. You do not want to bear the burden of someone dying because you did not inform the parents. That would be very difficult and profound. So let's go to the summary. It's important to know developmental expectations, take note, and seek professional help as soon as possible. Assessment is the key to program development. There are various kinds of assessment. There is no such thing as proper or improper assessment if protocols are followed well. The results are definitely correct. It is important to know that there are various functions of assessment. Each licensed professional giving assessment would use different kinds of tests. And early intervention enables a child with disability to achieve better. Take note of this. So with that, I end the session and we go to the most interesting part of the webinar, which is the Q&A session.
Thank you so much, ma'am, for this amazing presentation, for opening our eyes into disability and disability management. I'm sure we'll all be aware of all the red flag signs as teachers and be mindful to all the signs when we're paying attention to our students in our classroom. Before we begin with our Q&A session for today, I'd like to share with all the participants that as part of our workshops of our school's training program, we have an upcoming workshop on the Module 2, Workshop 2, which would be on addressing unique challenges faced by children with special needs, which would be conducted by Ms. Geeta Gopi, which would happen on the 23rd of September, 4 p.m. Indian time. And also we have, following Geeta Gopi's workshop, we have another workshop on identification, assessment, and intervention of special needs students in a mainstream school setting, which would be conducted by Ms. Gina Albermado, which would happen on the 30th of September, which again would be 4 p.m. IST time. So do book your calendar and also check out the link that's being shared right now in the chat box to register yourself to book your slots today. And also don't forget to share the link with anyone, with your friends and colleagues who might benefit from the workshop for them to learn and grow with all of us together. And also, I'd like to take you all through the resources to all the participants who've been with us for a very long time. As part of each of the workshops that you attend, you'd be given exclusive resources that you can use with your children in different settings. For the new participants, as ability workshops that you attend, you would be also given exclusive resources that you can use with your children. We've upgraded our platform and this is how our new platform looks right now. I'm going to show you where is that you'll be able to access all the resources. Now we made it very simple for you. All you have to do is log in with your ID and click on events. So all the events which are planned with us would appear here. And all you have to do is, you will have all the events appearing here. All you have to do is just click on the event when it appears, and you have a specific tab which shows resources. If you see right now, this workshop is going live. So you have everything simplified at one place where you can access everything here. So all you have to do is click on the particular workshop, and then you have the resources tab here. So all the resources that are getting shared for each of the workshops would be available and visible to you all here. You will be able to view them. You also have an option to like them, to let us know how effective this resource was for you, and also share it with fellow friends who you think would benefit from it. So as part of today's workshop, we have shared 5 materials with all of you to have a look and let us know how effective it was for you, so that we'll be able to prepare resources that benefits all of you. Now, let's begin with our Q&A session for today. Dr. Grace, are you ready to take the first question?
Oh, sure.
Yes. So we have the first question from Mr. Marlowe and others, who wanted to know, although you've shared some of the red flag signs with us, we wanted to know how is that we can pay attention to all these red flag signs in an online or a virtual session currently, and what is the first step that we have to take once we actually pay attention to these red flag signs?
That is a very interesting session because we are in online right now because of the pandemic. First and foremost, if you see red flags, for example, the child is getting zeros in the score, or the child is not paying attention, first and foremost, you could have developmental checklist. And I do encourage you to watch the session on assessment that would be facilitated by Ms. Gina Bermudo. She'll be talking about these things to you. So I do encourage that you have assessment in place. So you could have checklists. You could have screeners for red flags. And then you could also make very clear observations. So even if it's an online setting, How is the student behaving? As much as possible, camera on. How do the students behave? How do the students respond to your questions? How do the students spell their answers? So you have to consider normal developmental milestones. Are they having gaps? So these are the things that you have to consider. What are their posts on social media if you are a high school teacher? Are they saying that they want to leave this world? Are they saying goodbye? Are they posting things on self-harm? So these are definitely red flags. So these are some red flags that you might want to consider or watch out for during online class.
Thank you so much, ma'am, for sharing your insights. Next, we have a question based on your presentation by Ms. Ashwati, who wants to know, you mentioned about the internalizing and externalizing behaviors, right? If you could elaborate a little further on it, and what are certain things that teachers need to pay attention to divide them, whether it's an internalizing or an externalizing behavioral disorder.
Okay, thank you very much. Internalizing and externalizing behaviors are only characteristic up to the adolescent years. So after adolescence, you don't use internalizing and externalizing behavior. We don't even use emotional and behavioral disorders after the adolescent period. So as I said, internalizing behaviors, these are disorders, behaviors that are geared towards hurting the self, for example. Self-harm would be considered as an internalizing behavior because you harm the self. And then on the other hand, if you have externalizing behavior, harm could be done to other people. So if you have a person, a student who has conduct disorder and who intends to hurt people, coerce other students to do things for him or her, you are talking about an externalizing behavior. I will be talking extensively about internalizing and externalizing disorders. So you might want to watch that session for everything.
Yes, ma'am. Thank you so much for clarifying that. And we'll also have an upcoming workshop on all of this without assessment that I've shared with you. And we'll also have upcoming sessions with Dr. Grace. So stay tuned and also try and register and book your slot early as possible so that you will be able to attend all the sessions live with all of us. Next, we have a question from Miss Maria, who wants to know what is the best technique to calm children down, especially sometimes when children with special needs start showing tantrum or having a meltdown. We find it very difficult as parents or teachers to calm them down. So what can be done in such situations, ma'am?
Okay, so I have talked about that in the first session, positive behavior supports, that there are various functions of behavior. So if it's a meltdown, it's a sensory issue. So if the child has autism, definitely you have to take the aversive stimulus, take the child out of the aversive stimulus. For example, a very noisy room. So you take the child out. But sometimes they act out. In counseling, they call it acting out behaviors. Or they throw tantrums in behavioral parlance. There are functions. So it would be escape. The child would throw tantrums, for example, because he or she does not want to attend class. Okay, escape. And then what would be another function of behavior? You have escape. The child doesn't want to do the activity. The child would, for example, deliberately not do the homework in order for him or her not to attend math class the following day. For the child, it is immaterial whether he or she passes that that test. So you also have access to tangibles. So why does the student want specific objects? For example, the student wants to have extra gaming time. So the student would be misbehaving in class in order for him or her to get excused from the class so that he can go on gaming. So what are the functions? Is it attention? Is it escape? Is it access to tangible? You have to address that first. And then also, it would be best to have calming exercises. So you have breathing exercises for students. You have relaxation exercises for students. And these are very practical. Some of the exercises can be found on YouTube. You have to enable the students to be aware of their emotions and to express them in a more positive way. In the previous webinar, I talked about using a feelings wheel. So instead of them throwing tantrums, they can use the feelings to identify the feelings. So instead of punching their classmate, they would say that I am angry at you because you ate my lunch. So I'm angry at you. You don't punch the student. You tell the student that you are angry, but you do it in a constructive way. In this way, you help the students to manage their emotions. They have to be aware that emotions are there and they would be able to control them. So feelings wheel is an example of an exercise that
Very beautifully put, ma'am. Instead of brushing out the emotions completely, giving them a space to acknowledge the emotion is the way forward. Next, we have a question from Miss Aryati, who wants to know what happens in case if you're missed with early identification. And in case if the parents are very skeptical about taking the child for an assessment and the assessment and the identification process is getting delayed, what are the impacts that it could pose for the child and the child's development?
that is a very serious question because I have had clients who were assessed at age 20 already. And the damage really 20, 21, 22. And the impact of the gaps or the delays in assessment were really terrible that they could not manage the behaviors anymore. You could tell them that there is a need for assessment by being number one, objective about the findings. Second is to enable them to find agencies or governmental entities that would be providing these assessments at a lesser charge. If ever these things do not work, you could also do something. You could identify the strengths and limitations of the child, and you could teach based on the strengths and the limitations of the child. You could also do a functional behavioral assessment, and that would be discussed by Ms. Gina in her webinar. So you could do that, but it's very much important to tell parents that there is a need. That's your duty, just to tell, to inform. Now, let's also remember that there is a trans-theoretical model for helping. If the parents are in the pre-contemplation phase, meaning that they're not even thinking about having the child assessed, or they're not even thinking that something is wrong about the child, nothing can be done. Your goal is just to provide information and to provide enough observation in order for them to go to the contemplation phase, wherein they are thinking, oh yeah, I think that my child has a disability. Oh yes, I think that there is a need for my child to get assessed. So they're thinking about it, and you just encourage them to have their child assessed. And then tell them about the benefits of assessment. We could have a tailor-fit intervention for your child. So it's about communicating things properly. It's about presenting materials that would be acceptable by the parents. A lot of times, when parents disagree to have their child assessed, is that it was not presented to them clearly, objective observations were not identified. So the parent would naturally resist intervention.
Thank you so much, ma'am. Communication is the key. Sometimes we tend to feel that the parents are not going to be open to it, and we actually have a set mindset in our end. So communication and clear observation is the key to go about it. We also have an extension question on the same line from Mr. Joseph and Angela and others, who wants to know how is that you said, right? Like parents are in pre-contemplation stage and they're not ready to accept the child's condition. So how is that we can help them to move or encourage the parents to move to a stage of acceptance? What can we?
That's a very good question, because in the literature it says that people in the pre-contemplation phase do not think of any intervention. It's like smoking. The person smokes at the pre-contemplation phase. The person doesn't think that he has to quit smoking. But when the person already feels aches, pains, cancer, etc., illnesses, then the person would say, oh, I think I need to quit. I think I need to take the first step in quitting. So similarly, the parents, unless they see the need and they see the gravity of the situation, they won't get any intervention. It's just best for you to support the child. Okay, this is what is happening. To report if ever there are failures in class, to report if ever there are misbehaviors in class. Yes, you could do some behavior management and you can learn more about behavior management techniques if behavior is a problem. But it is very difficult for you to move the person to the contemplation phase. You need to have concrete evidences and you need to be very patient because sometimes it takes years before they have their child assessed. And sadly, by that time, a lot of things have to be rectified already. And don't feel bad if they don't seek assessment. It's not your fault. Your job is only to inform them.
Thank you so much, ma'am, for throwing that light to all of us, not to get too affected by it. Our job just lies on the fact of putting the observations from our end to the parents and also letting them know the importance of early identification and assessment and not take it too personally and let it affect us. We have another extension question on a similar line where Mr. Paul asks us, it's okay that it's important for taking the children to early assessment, but these assessments at some places are very costly and very expensive and not accessible to everyone. So what can be done by parents from a low income background? What can they do?
That's very good. So you need your resourcefulness here. So number one, there are government entities that provide assessment, but you have to fall in line and you have to wait. So there are pros and cons. You could also save up for it. You could also ask support from universities. They would definitely need clients when the students are in assessment class. So you could have the students subjected to assessment if your goal is diagnostic purposes. Now, if really finances or there's a problem of getting standardized tests or there's trouble getting a professional diagnose the child, then you go for educational assessment. This is the best thing. Remember that what is available is the best intervention for the child. It's the best. It's there. It's affordable. It's available. It's readily there. It's something that everyone could handle. But of course, it's another question that if the parents could afford and evade assessment, that's another question because sometimes they could be in denial. So it's another question. So if ever the scenario is, okay, I really have to make assessment, we can have achievement tests. What can the child do and what can the child not do? We can have checklists. So you have fine motor checklist, gross motor checklist, you have language cognitive checklist, etc. So you could identify here strengths and weaknesses and work on the weaknesses. So these are some practical things that you can do if ever diagnostic assessment is not available. Now, there's a big issue when it comes to assessment. For people in the clinical world, it is very much important to identify what the disorder is. For example, if you're talking about depression, what kind of depression is that? Are you sure that it's a unipolar depression? How sure are you that it is unipolar depression and it's not a bipolar 1 or bipolar 2 depression and it's not, for example, a borderline personality disorder? Because these disorders would be different kinds of psychotherapy. You would need to work on different objectives for these kinds of disorders. So similarly, when it comes to disability, I have known a person who was diagnosed, quote unquote, diagnosed because there's no official diagnosis. And this person was placed in a class for persons who have intellectual disability for 15 years because everyone thought that the person had intellectual disability. So the person turned 18 and apparently the person does not have intellectual disability, but the person is deaf. So you wasted all these years placing a child who became a man already in a wrong program. So that's the importance of assessment. So for diagnostic purposes. So for example, you place someone in a wrong program. Or there are some kids that I would test, or my class would go out and do assessment in schools. And we would find out that there are students who are placed in special education, self-contained class, who are not really having intellectual grades. So all their life, they missed on the opportunities of learning vis-a-vis their peers without disability and exploring, for example, the wonders of other subject matter that could be discussed. That's why I'm an advocate for having diagnosis and for having assessment at least. Yes, of course, there are situations wherein assessment cannot be given. So I understand this. That's why it's very much important to have checklists and to work on checklists and scales and observations in order to create programs for the child. But if the parents can afford it, go for the diagnostic assessment. And I would also go for multidisciplinary assessment because you see there the various angles wherein the disability unfolds.
Thank you so much, ma'am, for the lovely insight. I think everything would go into the quote where there is a will, there is definitely a way out. If not, you're not able to afford for an assessment per se. There are other ways in terms of screeners, observation checklists that you can definitely go on and look for the child's strengths and start working on that line. Next, we have a question from Mr. Prey, who wants to know how is that we can assess these children with disabilities or special needs conditions online, because some children tend to be inattentive and they have lack of interest, or they tend to be a little like late in their submissions of work. So how is that we can demarcate all of this?
Okay, so assessment in an online situation. First and foremost, I think you are talking about tests that are given by the teachers, summative tests. Now, assessment can be paper and pencil, and it could also be authentic assessment. Other ways for assessing skills would be enable the students to create a blog or a video, enable the students to create an information, education, and communication material, enable the student to have an advertisement campaign. So instead of you assessing on how much the student has learned math, science, values, education, or whatever concepts, there could be alternative ways of assessing the skill. And these do not necessarily have to be paper and pencil. But of course, for some subjects, such as math or science, I do recognize the need for assessment in terms of paper and pencil tasks. But sometimes you have to think out of the box and enable your students to create blogs, to create informative materials, to create learning materials for them to show that they know the concept. So it's up to your creativity this time. I would suggest that you read on ways on how to assess this and how to assess in terms of authentic assessment. That's a very good question.
Thank you so much, ma'am, for sharing your insights into it. Next, we have a question, which is a very case-specific question from Miss Julie, who wants to know that she has a child who is suspected to be suffering from ADHD. The parents, teacher, and the counselors in the school are already involved in working with the child. The child behaves very aggressively. So how is that we can help the child from being attacked or being beaten away from other people? Because when he tends to behave aggressively, there are repercussions to it also, right? So how is that we can protect the child and also like help the child out in such situations?
Okay, that is a very good question. And I think the problem is not only ADHD. There could be a comorbidity already. So I think that it's not ADHD based on how the question was phrased. First and foremost, you need to know and you need to observe why the student is behaving in such a way. What are the situations that make the student very aggressive? Talk to the students. Why are you expressing this aggressively? And I would suggest very much to have a functional behavioral analysis of this behavior, because there could be some triggers for the behavior, and there could be some factors that are causing this behavior to happen.
Thank you so much, ma'am, for that insight. Next, we have an interesting question from Ms. Angela, who wants to know what is the influence of parenting and parenting style in the development of conditions in children? Is there any direct correlation? A parenting style definitely has an impact on the development of the child, and especially development of any special needs condition.
Okay, that is a very good question, because some parents would blame themselves. So, for example, if it is physical, sensorial, if it is intellectual disability, if it is autism, parenting does not affect this. These disorders are not a result of bad parenting. However, this is where parenting comes into play. Internalizing and externalizing behaviors. Sometimes a child would self-harm because of the parents. So, for example, if children would say that I have helicopter parents, my parents would be picking on the nitty-gritty of my daily activities. My parents would always be doing this and that to me. My parents would intervene all the time, and the parents seem to be intervening even in answering the modules of their children. So that happens. They are very much involved, overly involved. So, according to the literature, people perform their best if they are given the chance to show their abilities. So, this is the literature of motivation. They are motivated to finish and continue tasks if they know that they have the ability to complete the task. The task should not be very easy, otherwise, the person would not be interested on the second task if it's very easy. And the task should also not be very hard. So it has to be dependent on the skills level of the child. So the children should have activities that are within the range of their skills. They could have challenging activities from time to time. Now, for parents also, if the parent is very permissive, there's a problem with this, because the child could play computer games 24/7, or the child could eat unhealthy food because the parents would allow the child to do so, or if the parents are too strict. So, internalizing and externalizing behaviors, there is literature also that is related to the inability to parent, that gives the children enough freedom to be themselves and to have their natural talents and abilities. So that is where parenting comes into play.
Thank you so much, ma'am. I think we'll all reflect upon our own parenting styles and how that is actually having an impact on our child's development. Next, we have a question from Ms. Ira, who wants to know, are teachers allowed to identify the level of the child's performance? Are they allowed to do any assessment? If so, yes or no? I'd like to know your answer for that. We also have an extension question to that, ma'am.
Yes, it's very much important that you know the child's performance when it comes to achievement. Because, of course, you have achievement tests in school. So you have to know if the child is performing at grade level, above grade level, or below grade level. However, when it comes to standardized testing, of course, if you're a teacher and you have the license to do so and you have all the credentials, okay, you can have this diagnostic assessment. So, for example, you're a teacher from 7 a.m. to 12 noon. And then in the afternoon, you have a role as, for example, an assessment specialist, because you are, as a psychologist, you run a clinic. So that could be the case. You could do assessment if you have the license and you have the degree preparation. Because it's very much important for you to have the license for you to be able to assess. And of course, you won't be given the authority to purchase. these tests. If, for example, you don't have the professional qualifications, they're very strict. You have to submit all your credentials to them, and you have to name where you graduated from. You have to name the specific courses that you took in order for you to prove to them that you can interpret a standardized test. They look for specifics. They look for your practicum. Where did you have your practicum? Did you conduct, did you have your practicum in hospital setting? Did you have your practicum in a school setting? The publishers are strict with that. You submit. And then there's one test publisher that I had to submit a copy of my license plus my transcript of records. So if you have these credentials, you can do assessment of C-level tests, and most of them are diagnostic in nature. But if not, you could do classroom assessment, and there's nothing bad with classroom assessment because you identify student achievement, and that is also a form of assessment, and you are doing a great part in the life of the student because you were able to identify if the child is performing at standard, below standard, or above standard. So these are classroom assessment tools that you can take. Observations, tests, and of course, if you are a teacher, you have discussed index of discrimination and index of difficulty in your test and measurements class. These things will be very handy in real life. So you could check on the achievement of your students.
Thank you so much for clarifying that, ma'am. That gives a lot of clarity on where the boundary lines for teachers and where it has to have a professional certification for standardized purpose of use of assessment. Thank you so much for clarifying that. Next, we have a question from one of our participants who wants to know, especially when we are working with teenagers or children in elementary or high school levels, what happens is, right, they tend to feel a lot shy and they feel that everybody's focusing on them. So they're not ready to turn their cameras on, and we actually do not know what is happening in their life. So in such cases, how is that we'll be able to identify, given today's scenario, if they're going through something which is challenging or difficult?
That is also very difficult to ask because you have to be involved in the lives of your students. So you have to look at social media posts. You have to listen to what their classmates are saying. And one very practical thing to do is to have a check-in session. If you are doing remote learning and all of the learning materials are in modules, you can have the check-in session written. And of course, when the parents give you back the modules, you will see there the emotions of the child. You could also have a check-in asking for, how are you doing in this project? How do you see the class? Could you describe to me how you are surviving or thriving in this class? So you could have a check-in activity in order for you to identify if there are issues and concerns.
Thank you so much, ma'am. The identification through the Facebook or the social media post is a common way to do it because most of our children are actually active, especially in the teenage years. So that would give us a very good idea. Just a question on those lines from one of the parent who wants to know, like, what nowadays children are too much with their phones. Given that they're also having online sessions, everything is virtual right now. They are actually addicted to your phones and they don't want to like get out of their phones most times. So what can we do in such situations?
Okay, that is a very good question. I would answer that. So when it comes to phones, gadget use, it is discussed in digital citizenship that a good digital citizen manages online and offline tasks well. So that's part of digital citizenship, and our young people are being oriented on digital citizenship. You have to orient them that these are the only hours where you would use your phone, and these are the hours that you won't use any phone. Also establish no phone zones in the house. For example, in the dinner table or when eating, you're not supposed to use your phone. You are supposed to interact. Also, if you tell your child not to do so, not to use the phones, you should also be setting the example. Next, during sleeping time, the phone also goes to sleep. So remember, when you sleep, the phone goes to sleep. Next, you could also get the phones of your kids if ever the the time period for not using them is already there. So get the phones of your kid and keep the phones and then promise to give them back. Next, you could use a reward system. You could use a token economy system for using the phone. For example, this housework would be equivalent to these points. When you have acquired this number of points, or 100 points, for example, you have 10 minutes of phone use. So if you want to play your games or if you want to listen to your music, you have to do these things. So you have a token economy system. So you can do these very practical interventions. Next, about social media use or addiction to computer games, there is also literature that suggests that there is a relationship between depression and gaming disorder. So you have to check because sometimes children who get addicted to computer gaming do so because this is their only way that they could achieve. For children who have ADHD, they find games very amusing. They find the digital effects very amusing and there could be hyperfocus because they are continuously engaged in playing computer games. They would not achieve well in school. And when this happens, they could suffer from depression because of having no self-esteem, because of thinking poorly about themselves, because of a lot of failures that they have already had. So playing computer games, using the phone, all of this can be managed. You have to talk to your children on how you will manage and be firm when you are implementing the rules. You have to put the rules of computer use or phone use in black and white in writing. So these are some practical tips and I hope this helps.
Thank you so much, ma'am. I'm sure we'll all try this out and get back to you with our feedbacks. I think this will be very effective and very practical in nature to try with our kids. We have one question, which is an extension of a question that I asked earlier, where I said, like, some of the teenagers are very conscious and they tend to put the camera off and like they lack their confidence. They don't want to come online per se. But there is another end to the spectrum also, where some children are very attention seeking in nature, especially in their adolescent phase, and they do anything and everything to grab the attention of the teachers in a classroom setup. So what can be done by teachers to handle such children, especially in their teenage age?
Okay, that is also a very good question because one function of behavior could be attention. So sometimes you have to know why do they crave for attention. Sometimes there's no attention given at home. Sometimes the parents are always fighting. Sometimes the parents are busy at work that there's no attention at all. So these are some scenarios, some examples that could lead to attention-seeking behavior. And of course, it could also be that attention seeking is a function of some behaviors that are related to ADHD because they are sometimes impulsive and sometimes because of impulsivity, they seek attention. So the scenarios are different from one child to another. So it's very much important, number one, to observe why the behavior is happening, when the behavior is happening, and how often, what's the frequency of this behavior that is happening. Oh, yes.
Thank you so much, ma'am. That's the key. I think this will also benefit a lot of us, especially dealing with children from elementary or high school levels per se. Let's take the last question for today. This question is from Miss Myla, who wants to know, like, how is that as educators or as therapists, we can communicate to parents about the child or the child's need without offending them? Like whatever signs that we've observed over a period of time, how is that we can put it across in a very pleasant way without offending the rights of the parents? What can be the best way to go about it, ma'am?
Okay, first is present all the good points. Okay. Then present all the bad points objectively. No emotions, just objective observations. Last, end with a positive note. These are the good things that I see in your child. And these are the potentials that I see. And I hope that you address these things that are not so positive about your child in order for you to have optimal performance in school.
Thank you so much, ma'am, for wonderfully answering the final question. Also, I think we had a lot to take away from your session today, and also a lot of learning from your Q&A. I'm sure we're going to try all the practical tips that you've suggested to us and get back to you. Now, I'd like to check with you your final words to all our participants today who've been actively participating throughout today's session.
Okay, thank you very much. And I also have been reading the questions in the chat box. Some of them are about technology and inattentiveness in the regular class. You could try technology also. There's an app called Team Viewer wherein you could see what your other students are doing during online class. So that prevents off-task behavior. Next is to observe the children or the students very well in order for you to make an accurate assessment of their behavior. So observe them very well. What causes the behavior? What is the behavior all about? How often is the behavior? Are there particular times in the day wherein these behaviors are committed? And then also, you have to seek professional help whenever it is needed. Everyone would be needing help, and help extended, help given at an early period would be very good in order to have your child to have optimal performance. Whereas if intervention is given at a later age, a lot of gaps have to be addressed already. So early intervention is the key. Next is that we are trying to create a non-handicapping environment and a non-stigmatizing environment. Our students have different talents and abilities, even if they have disabilities. And we always have to focus on their ability to become. Let's address the behaviors that are maladaptive or the behaviors that are not that positive or need to be addressed. And then let's also focus on the things that they can do very well. So when all of the intervention given has already been given and there is very slow progress or there is no progress at all, sometimes we have to, if ever that is intellectual disability, we have to look at other modes of educating our child. It could be that the child could be placed in a tech box scheme. Let's remember also that there are different placement schemes. You could have a special education classroom that is self-contained. You can have a child attend some regular classes with special class. You can have a hospital-based setting. You can have a community-based setting. You can have right now an online and a home blended setting. So there are various kinds of placement schemes that are available. And of course, the placement schemes that would be the best for children would of course be the placement schemes that are practical and are readily available. Same is true with assessment. So there is much hope. Even if a child gets diagnosed to have a disability, you will never know how much they will achieve unless you see with your eyes the talents that they possess.
What a wonderful way to end the session, ma'am. Thank you so much. We personally had a lot to learn from you. Thank you all participants for actively participating throughout today's sessions. During the entire process of the session, I've seen that the feedback link has already been shared with you all. Now we made the feedback submission process very simple. All you have to do is go to our platform under the events near your resource, you have your feedback tab, and you can just fill in the feedback from there and let us know how effective this session was for you so that we can improve the experience for all of you all. And don't forget to register yourself and booking your slot for our upcoming workshops. Until we meet you for the next time, it's a big bye from Team Ability. Stay safe and take care.